The American Heart Association has had a long-standing commitment to cardiovascular research. In fact, it's the leading lay organization advocating for better cardiovascular health and treatment. They have spent an enormous amount of time and resources not only lobbying Congress and the NIH to fund cardiovascular research, but actually using their own funds raised from the community to help support research. For the last several decades, they've really focused on basic science research, from the cell to the organ to the vasculature, trying to understand the pathophysiology of cardiovascular disease. Over the last 5, 6, 8 years, they have started to recognize that there's an enormous chasm between when knowledge is available to when it's actually used day to day in providing care for patients. As such, they've decided to make a really focused investment on what we call outcomes research, the understanding of specific patients' outcomes and how we can look at the system of delivering healthcare to people in order to be able to take new knowledge as it becomes available and move it rapidly to the bedside so that patients can benefit. About 18 months ago, the Heart Institute, so pleased with its initial investments in outcomes research, really upped the ante by sponsoring the first ever National Outcomes Research Center competition. And this was an award that was intended to support not only 1 to 2 very important and innovative clinical research projects, but also the training of the next generation of outcomes researchers. And they ultimately awarded 4 centers. And we were very fortunate to be selected as one of those centers, along with Duke University in North Carolina, Stanford in Palo Alto, and UCLA in Los Angeles. With this funding, which is almost $3 million over 4 years, we're able to do 2 really important things for our community. The first is we are able to train the next generation of outcomes researchers. Secondly, we were able to support a very innovative research project. And this is one that's very near and dear to my heart, because for a decade, we at St. Luke's Mid-America Heart Institute have been working on the technology to take complex prediction models, which estimate a given patient's outcomes, and to execute those at the time of medical decision making, so that as physicians we can be better informed in how to best treat an individual patient, and from patients so that they can understand the risks and benefits of treatment and engage in a discussion with their physicians about what treatments are most aligned with their own individual goals and values. This project, called the PRISM, is now rolling out at Mayo Clinic, at Integris in Oklahoma City, and at Yale, all funded by the American Heart Association, and will allow us to test the delivery of these risk prediction models before percutaneous coronary intervention, or angioplasty. And we do this by completely transforming the informed consent process from a very legalese, uninformative document to a very patient-centered educational document that shows each patient their risks of complications and benefits, and allows the doctors to tailor the therapy to each patient. What our consent form does is it educates patients in a very simple diagrammatic thing with big figures showing what is an angiogram and what is a stent or an angioplasty. And with this information, our patients have been much less anxious as compared with our original consent form. They read the consent form much more often. The doctors report that they ask lots of questions now, which is obviously very good, but a very big change from what originally had happened. And the doctors say that it is very helpful to them to be able to understand an individual patient's risks of bleeding, for example, or having to come back for another procedure as they select the optimal treatment for that individual patient. In Kansas City, by being the center point of all this research, we have the opportunity to start using, understanding, and really leading the nation in how to better treat individual patients. And when you think about all that's going on in Washington, D.C. about trying to transform American healthcare to be more cost-effective, more patient-centered, more evidence-based, safer, and to be individualized to each individual person, this is exactly what they're envisioning. And we were able to develop it here, to be able to pursue it here, in large part because of the support of our community and because of the support from the American Heart Association.